Good morning. My name is Dr. Susan McDonald, and I'm the president of the NLMA. Joining me here today is Dr. Paul Johnson, a urologist at the Health Sciences Center, and Dr. Janelle Taylor, a thoracic surgeon at St. Clair's Mercy Hospital. We invited you here today to alert citizens of the province about the challenges facing surgical services at our tertiary care centers. The past 2 years have been very difficult for everyone in our province, especially those working on the front lines of the pandemic and the thousands of citizens who have fallen ill to COVID-19. The Premier stated that as Omicron peaks, the light at the end of the tunnel is shining even brighter. And while this is promising, another healthcare crisis has taken hold in Newfoundland and Labrador that is impacting thousands of patients. Over the past 2 years, multiple health system shutdowns have resulted in canceled surgeries and unmanageable wait lists for surgical procedures. The NLMA has been informed that the problem extends to hospital surgical units throughout the province, including St. John's, Carbonear, Gander, Grand Falls, Windsor, and Corner Brook. The primary reason for these shutdowns is COVID-19. New variants of the virus and surges in COVID cases led to closures of operating rooms for non-emergency surgeries, as well as redeployment of operating room nurses to assist with the pandemic effort. Some hospitals were also impacted by the cyber attack, which led to the cancellation of non-urgent medical and surgical procedures. The problem is particularly acute at our tertiary referral centers in St. John's, which includes the Health Sciences Center and St. Clair's Mercy Hospital. Doctors there are telling us at present they cannot provide patients with access to non-urgent but still necessary surgical procedures in a safe, acceptable time frame. Physicians who provide surgical services at these hospitals pooled their waitlist data and found that there are more than 6,000 backlogged operative cases at those 2 sites alone. The problem also extends to other sites in the province. However, the backlog crisis is most severe in St. John's. We know that many patients are now waiting 2 to 4 years for necessary surgeries, and the backlog is growing. Each one of those cases is a person who is waiting for a surgical procedure that could significantly improve the quality of their life. The backlog affects patients waiting for general surgery, urologic surgery, orthopedic surgery, thoracic surgery, neurosurgery, plastic surgery, gyne-oncology surgery, and ENT surgical procedures. When patients who need surgical services are forced to wait longer than what is considered safe, they experience unnecessary suffering, and their prospect for a successful outcome is reduced. For some Newfoundlanders and Labradorians, this can mean the difference between life and death. The situation is particularly troubling for cancer patients. While chemotherapy and radiation continued during the system shutdowns, patients waiting for cancer surgeries have faced considerable delays. Access to operating rooms for cancer surgeries was drastically reduced in January and February, which contributed to more than 200 backlogged cancer operations. Detection by screening colonoscopies and breast mammograms was also significantly affected by service shutdowns. Surgeons are telling us that these delays are risking tumors becoming inoperable, and this puts considerable strain on patients, families, and their caregivers. Physicians are speaking out now because they're deeply concerned about the well-being of their patients. Surgeons wrote to Eastern Health senior management in January to outline the magnitude of this issue and the barriers limiting their ability to reduce the backlog, such as the chronic lack of available beds for patients following surgery and the lack of available nursing staff. They advised us that Eastern Health acknowledged the problem and expressed interest in exploring solutions. The NLMA acknowledges that regional health authorities are working to increase system capacity and bring services back to pre-pandemic levels. But more needs to be done. The waitlist for surgeries is already unmanageable. We cannot allow this to get worse. Our priority has to be reducing the current backlog of cases. We also need a long-term plan in place to deal with the future operating room disruptions and unplanned surgical cancellations. We know that the new COVID variants and other events can emerge in the months and years ahead, so we need to be ready for them. The NLMA is calling on the provincial government to implement the following short-term solutions. First, commit to reduce the surgical backlog in the province to pre-pandemic levels by a fixed date. Second, bring together stakeholders, including frontline surgeons and nurses, to assist health authorities in developing a plan to reduce the backlog and oversee the plan's implementation. Third, increasing operating room capacity by maximizing operating room time and all available operating rooms within regional health authorities. And finally, ensure transparency and accountability by establishing an online dashboard to report the number of backlogged surgical cases. These numbers could then be updated at least monthly as the backlog is reduced. We envision that this could work much the same way as the government's online dashboard for reporting COVID-19 data. If the government can report the weekly numbers on COVID vaccination rate, they can certainly report on the reduction of surgical backlog as well, which is a tremendous public health issue. In the long term, physicians are also calling on the government to address the more than 600 nursing vacancies in the province, which puts pressure on all areas of the healthcare system, as well as increase bed capacities in hospital to reduce the impact on surgical services. The government has an obligation to ensure that we have an appropriate number of nurses and available beds in our hospitals. Patients should not suffer because of a failure to properly staff and resource our healthcare system. Another theme we heard from our members is that many surgeons were not consulted prior to canceling their surgical lists. This left some doctors scrambling to explain to their patients why their operations were canceled. Our members have also told us there's little coordination or consultation with surgeons at different sites within the regional health authorities on how they can work together to reduce the backlog. Doctors are ready to be part of the solution in addressing this backlog, but they need to be at the table when these decisions are being made. I'll turn it over now to Dr. Paul Johnston, who will offer some insight into the backlogs that surgeons in St. John's are grappling with.
Hi, folks. My name is Paul Johnston, and I'm a kidney, bladder, and prostate surgeon at the Health Science Center. I focus mainly on cancer surgeries. I'm also chair of the Specialist Committee of the NLMA, and it's in that capacity that I'm here to talk to you this morning about what has happened to my wait times for operations over the last 2 years. Since the beginning of the pandemic, everyone in healthcare in this province has worked very hard to prevent COVID from overwhelming our hospitals. Unfortunately, as part of that worthy effort, OR availability for surgeons across all specialties has been severely limited on several occasions for days, weeks, or even months at a time. As a result, a substantial percentage of patients are waiting longer than nationally accepted standards for a wide range of procedures, including cancer surgery. I personally have been forced to delay the removal of prostate cancers, kidney cancers, bladder cancers, and testicular cancers while waiting for OR time to become available for my patients. Many of my colleagues have voiced their frustration to me about a similar lack of OR time and the ongoing cancellations. There are risks that such delays can result in spread of cancer and loss of cure. Those risks are real. This isn't just a cancer problem. The wait time for elective surgeries can ruin lives too. Some of my colleagues have patients who have been waiting years for hernia operations, without which 48-year-old men with mouths to feed and mortgages to pay are unable to work out on the rigs or anywhere else, and their families risk falling into financial ruin. Maybe calling such a surgery elective is the wrong word. Maybe necessary is a better one. Surgeons have been sounding the alarm since the first wave of COVID that wait times were going to get out of control. That has arrived on our doorstep. We need a plan should another wave of COVID arrive. The only thing worse than wait times now will be wait times after another wave of COVID shuts our ORs again. We need a plan to get back on track. As COVID recedes, we have an opportunity to clear some of the backlog, to let people get on with their cancer surgeries, their hip surgeries, to help people feel good about the future again. I'm asking members of the media and the community at large to have a serious discussion with the government of Newfoundland about getting Newfoundland's wait times under control. Let surgeons do their part to protect this province's future. Let us do the surgeries we were trained to do.
Thank you, Dr. Johnston. I'll now invite Dr. Janelle Taylor to say a few words about the challenges facing surgeons in her discipline.
Thank you, Dr. McDonald. Good morning. My name is Dr. Janelle Taylor, and I'm a thoracic surgeon at St. Clair's Mercy Hospital. I am one of 2 thoracic surgeons currently providing surgical care for the province. The majority of my practice is also cancer, primarily lung and esophageal cancer, where surgical removal of the tumor is often the only option for cure. During the past 2 years, unprecedented events have created the need for redeployment and redistribution of healthcare resources. And because of this, we are seeing increasing numbers of patients waiting for surgery. This is hard not just for our cancer patients, but for the patients awaiting non-cancer surgeries as well, because we know that many of these conditions are life-debilitating. This problem also creates moral distress for the surgical team, as we know our service delivery is being impaired. And although there is hope moving forward, we still face a system plagued with nursing shortages and burnout, bed shortages resulting in cancellations, and the ongoing uncertainty of future service disruptions. In 2 years, we have endured Snowmageddon, a cyber attack, and a global pandemic, all of which caused disruptions and delays. We are on the road to recovery and getting back to normal. But our concern is that if further events occur, there is simply no plan in place to prevent the same issues from happening again. Our ability to provide care to the patients of Newfoundland and Labrador faces enough challenges at baseline with our expansive geography, sometimes limited resources, and smaller numbers of healthcare providers. But we are a resilient and proud group of people, and we want to use that strength to advocate for our patients and to address current system issues. Thank you.
Thank you, Dr. Taylor.